Life and health insurance final exam. Claims are paid to the underscore 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 policy owner. Failure to notify a disability income carrier of a change to a higher risk occupation will result in a underscore 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 of benefits. Reduction. What type of facility exists to serve the needs of the terminally ill? Hospice. Under Part B of Medicare, what percent of the costs does Medicare pay after the deductible? 80%. A COBRA qualifying event does not include termination due to gross misconduct. Underscore 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 is a health insurance policy that only covers surgeries, surgeons, and anesthesiologists. It provides first dollar benefits by the insurer, but low limits. Basic surgical expense. If underscore 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 or underscore 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 not prescribed by a doctor or linked directly to a loss, then the claim may be denied. Intoxicants or narcotics. Underscore 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 provision provides that you only get paid once regardless of the number of policies with the same company. Other insurance with this insurer. Underscore 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 allow cancellation with underscore 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 days written notice. Cancelable policies. 5. Which policy would be covered with the rights of a dependent child? Major Med. Underscore 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 must be returned to the company within 90 days of the loss or as soon thereafter as reasonably possible. Proof of loss. Underscore 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 is a health insurance policy that only covers room and board if the insured stays overnight in a hospital and the miscellaneous expenses that occur because of that stay. Basic hospital expense. A policy owner may sue their company for non-payment of a claim after underscore 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 days of submitting claim forms, but no more than underscore 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 years. 63. Which of the following statements about group medical expense contracts is not true? Group insurers do not like employee turnover. Underscore 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 is take compulsory hospitalization insurance funded by all workers through FICA taxation that provides coverage for inpatient care. Medicare Part A. Underscore 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 is a voluntary coverage for supplementary medical insurance to pay some of the costs of physician and medical services on an outpatient basis. A monthly fee is paid by beneficiary. Medicare Part B. A policy owned by a business that can pay on a reimbursement basis for actual costs incurred during the disability of the owner/operator is called business overhead expense. If you are still covered by group major medical plan at age 67, what is considered to be the secondary payer? Medicare. The individual who controls a major medical policy, pays the premiums and is authorized to receive any benefits from the contract is known as the owner. A disability income policy deductible is expressed in time and known as an elimination period. Medical expense claims must be paid _________________________________________ and disability income no less frequently than ___________________________________________________________________________ Disability income benefits are intended to pay for all of the following except doctors. If you are terminated from your employment, you may be able to continue group health coverage under COBRA. A business overhead expense policy would not pay for owner's salary. Underscore 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 is deducted from a claim payment if the loss is incurred during the grace period. Unpaid premium. Benefits paid to employees under a group non-participating disability income policy are taxable. If the Social Security qualifications for disability are met within 60 days of employment termination, COBRA may be extended for an extra underscore 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 months. 6. Short-term disability is underscore 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 year, s, or less. 2. Underscore 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 is the federal government-sponsored health care program for individuals age 65 plus, suffering from renal failure, or recognized by Social Security as disabled and collected 24 months of Social Security disability benefits. Medicare. Underscore 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 provides that an MSP may not simply duplicate Medicare benefits. Duplication. Underscore 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 is the key rating factor for disability policy. Occupation. Underscore 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 means that if you earn less at the time of the claim than you did when you bought the contract, your benefits may be reduced within limits set by state statute. Relation of earnings to insurance. Underscore 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 is a health insurance policy that offers broad coverage and high benefits for hospitalization, surgeries, and physician services subject to deductibles and coinsurance. Major medical expense. MSPs are allowed to classify medical diagnoses and treatments as pre-existing if occurring within underscore 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 of the policy date and excluded for underscore 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 of the policy date. 6 months. 6 months. Using the information above, how much would Jack's policy pay? $2,000. Standard premium plan grace periods are underscore 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 days for weekly underscore 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 days for monthly underscore 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 days for all other premium payment plans. 7, 10, 31. Group policies create a contract between the organizing entity of the group and the insurance company. underscore 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 provides that companies may coordinate benefits, but you still only get paid once. Medical/disability expense coverage with multiple companies. COBRA is available for departing employees of plans which insure more than 20 employees. Underscore 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 provides that an MSP may not be classified on the sole basis of age or deterioration of health. Guaranteed renewable. Underscore 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 requires the insured to be unable to perform any occupation they would be reasonably suited to do based on education, training or work experience in order to receive disability income benefits from the policy. Any occupation. The coordination of benefits provision in a group medical expense policy is designed to allow the insured to collect some benefits from each of the plans of two employed spouses. A policy owner has the right to name, change and designate underscore 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 beneficiaries. Underscore 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 an illness of injury that prevents an insured from performing one or more of the important duties of their job, but not all of the occupational duties. Partial disability. The amount of loss paid by the policy owner before the health insurance policy pays the claims is known as deductible. Underscore 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 provide that the terminology used in an MSP can be defined no more restrictively than it is defined by Medicare. Definitions. Which of the following does not qualify a person for Medicare? Being impoverished. Underscore 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 is the prescription drug benefit program offered to Medicare beneficiaries who pay a monthly premium and an annual deductible to share the cost of prescription drugs with Medicare. Medicare Part D. Generally, policy limits are limited to underscore 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 percent or underscore 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 percent of your earned income. 60%, 80%. Which of the following do medical expense companies utilize to eliminate small claims? Deductibles. Charlie owns a comprehensive major medical policy with a $1,000 base plan, a $500 deductible and 80/20ths coinsurance. If he suffers a covered loss of $9,500, how much will the company pay? $7,400. The incontestable provision gives companies underscore 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 to legally contest the validity of a contract or deny a claim on the basis of misstatement in the application. 2 years. Any period exceeding underscore 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 years is considered long term. 5. Underscore 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 provides that individuals over 65 who have just enrolled in Medicare Plan B for the first time cannot be refused an MSP or rated if they apply for coverage within 6 months of the Part B enrollment. Guaranteed income. Hospital insurance is found in Medicare Part A. Both Jack and Jill's plan contains a $1,000 deductible and 80/20ths coinsurance. If Jill sustains a covered loss of $6,000, how much will her policy pay? $4,000. The entire contract is comprised of application and policy. Generally, group MSBs should have a loss ratio of ____________________ and individual MSBs of ________________________ 75%, 65%. Will pay the estimated Social Security disability benefit while Social Security is determining eligibility. Additional monthly benefit. Is a health insurance policy that does not have a deductible. The company pays first when a claim is submitted. First dollar coverage. Mary has a major medical policy with a $200 deductible and 80/20 coinsurance allocation. If she suffers a covered loss of $8,200, how much will Mary be required to pay for this loss? $1,800. You own a major medical policy with a $500 deductible and 80/20 coinsurance. You suffer a covered loss of $4,500 and calculate that the company will pay $3,200 towards your loss. The company only pays $3,019.78. Which of the following could not account for the difference? Elimination period. If the COBRA qualifying event is death or divorce, benefits may be extended up to ________ months. 12. Which part of Medicare provides nursing home coverage? Part A. An MSP must offer a free look period of _______ days. 30. Timely entry is defined under HIPAA as no more than 63 days. Is a disability income payment based on the proportion of mission employer income. Residual disability benefit. COBRA extends coverage for you and your dependents for up to 6 months. Which is the correct order of the basic claim calculation? Apply the base plan, subtract the deductible, allocate the coinsurance, check by adding. The Affordable Care Act allows dependents to remain on a parent/guardian's healthcare plan until age 26. The annual blood deductible under Parts A and B is ________ pints. 3. What feature of major medical policy requires 100% payment of covered expenses after the insured's claim cost reaches a certain level? Stop loss. Is a health insurance policy that only covers physician services and procedures. Proves first dollar benefits by the insurer, but low coverage limits. Basic medical expense. Underscore provision requires companies to be notified of a loss within 20 days or as soon thereafter as reasonably possible. Notice of claim. Which of the following do medical expense companies use to reduce adverse selection? Pre-existing conditions limitations. Companies are under no contractual obligation to a lapsed policy, but may do so at their discretion. Reinstate. Underscore 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 is a type of health insurance that provides stated benefits for long-term care services typically taking place in a nursing home or home health care. Long-term care policy. Underscore 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 provides that changes in Medicare will automatically trigger a change in an MSP. Mirroring Medicare. Underscore 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 is an exception to the incontestable clause. Misstatement of age or gender. MSPs must be notified of Medicaid eligibility within underscore 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 days. 90. Underscore 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 is a health insurance policy offered by commercial health insurers to fill the gaps in Medicare coverage. Medicare supplemental policy. Jack and Jill are married, each has employer-sponsored major medical coverage for the entire family. Jack was born on June 13, 1979 and Jill on April 1, 1981. Whose plan is primary for the children? Jill's. The company has the right to conduct a underscore 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 and underscore 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 to validate an accidental death claim. Physical exam, autopsy. Underscore 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 requires that the insured to be unable to perform the duties of his or her own occupation in order to receive disability income benefits. Own occupation. All of the following characterizes basic medical except ancillary expenses. Underscore 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 is a type of traditional medical expense insurance designed to reimburse the policy owner for out-of-pocket medical expenses. It is characterized by typically low deductibles, 100 to 500, coinsurance, and stop-loss limits. Comprehensive major medical. Coinsurance does which of the following? Reduces the deductible. Underscore 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 promises to pay the amount Social Security would have paid if Social Security disability would have been approved. Social Security rider. A policy used as a salary continuation plan for a disabled individual employee is key employee. Claims incurred while in the commission of a underscore 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 or while engaged in an underscore 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 can be denied. Felony, illegal occupation. What federally funded, state-administered medical expense program is designed to serve the poor? Medicaid. Underscore 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 provides that if a policy is issued in a state that does not conform to state law, it will be interpreted as if it did. Conformity with state statutes. Underscore 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 must be transmitted to the policy owner / insured within 15 days of claim or claim notification. Claim forms. Mentally or physically handicapped dependent children can remain on their parents' plans indefinitely. Which plan is primary if two employer-sponsored spouses share the same birthday? whichever has been in effect the longest. Underscore 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 details the benefits, coverages, rights of renewal and premium increase provisions. Outline of coverage. What type of disability requires no proof of loss of time or duties? Presumptive disability. Which of the following would be the least expensive structure for a disability income policy? Any occupation with 30-day elimination period. Underscore 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 is a disability income policy provision that specifies after a period of time if the same disabling condition reoccurs, the stated benefit will be paid without an elimination period. The reoccurrence will be treated as a continuation of the prior claim. Recurrent disability provision. Underscore 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 is a program that offers a variety of Medicare managed care choices. Medicare Part C.